Hello, dear aquarist. Welcome again to one of my videos on a case of fish diseases that I examined when I do my work as a fish doctor at an international trader of ornamental fish. And I present my findings while using a microscope and using my camera to give you the details of my findings, and I hope that helps you to understand what is fish diseases, what can we find, and what can we do about it. And today it's about an Oscar Cichlid Astronotus with gill flukes, bacterial infection in the gills, and internal organs that are infected with bacteria due to the gill fluke infection. My books on fish diseases are available in different languages. The link is below. You look for it and you can find the books you might need to do better observations of your diseased fish and particularly to do better treatments, accurate treatments which are well described in my books. Here I show you the albino Oscar Cichlids that are suffering. You can see the respiratory problems. They're suffering, they're skinny, and some are dying. I repeat again the video so you can see it again. Well, if you see this sign in your aquarium, you know something is troubling the fish, in particular in the gills. So, and examining the gills, well, this revealed or showed us that the gills had bad bacterial infection, a lot of necrosis. You can see here big parts of the gills are gone. I call that gillmonia instead of pneumonia for humans. This is the gillmonia for the fish, damaged gills. You can see here the rotting tissues, so the gills are very badly infected with bacteria. Here is a gill fluke sitting there, and then I show it here next in the video. You see one gill fluke still alive there, still active. There might be a few more here underneath the necrotic tissue, but there was a case of gill flukes previously. The fish have been examined before and we had found gill flukes, so we implanted treatments, or I would say I advised to give treatments against gill flukes, but there was no treatment against the bacteria. So this was a lesson learned for those people that executed the treatment that they should also apply an antibacterial medication when the gill flukes cause that damage. Because that damage on the gills also brings bacteria inside to the fish. They penetrate through the gills and through the bloodstream, and then you can see the kidneys are affected. You can see that this is an unhealthy kidney. You can see the spleen here with melanomacrophage centers, which is a reaction to bacterial infiltration. The liver was in bad condition, not looking very healthy, looks like necrotic tissue inside. Well, that's what's our conclusion. The bacterial infection, especially in the gills, is killing the fish. And that should be treated as soon as possible with an antibacterial medication, like an antibiotic or others. Ask your fish doctor for advice or read my books. The few gill flukes, they are a leftover from previous treatments, and I would not treat now, since there were already two treatments executed. But the gills were affected by bacteria and the internal organs. But still keep an eye on the evolution of those gill flukes. Maybe in the future you need to apply again an anti-fluke treatment. But the gill flukes cause the damage and the cause of a bacterial infection. So lessons learned, well, be aware. When parasites infect the fish, secondary bacterial infections might penetrate the fish, might affect the fish, and those are the ones that eventually kill the fish. A fish food can help, of course, to help to repair the fish, like Dr. Bassleer Biofish Food Aloe Vera or Grapefruit Seed Extract Moringa. My books on fish diseases can help you, available in different languages. or my Patreon training, or you can get the training in fish doctoring. Try to become an expert if you want. You can become an expert. I'm a consultant, but you can become a better fish care person. Thank you for watching this video because it made you already a little bit more expert because you understood the importance of fish diseases and to take care of your fish. Thank you for watching.